Hello, everyone, and welcome to the Practice Perfect podcast. It is another week, and we're back. Welcome to the show, Maya. I'm back. I mean, what a crazy 2 weeks we've had. I will apologize. I mean, I'm not going to apologize for going to the Caribbean, that's for sure,
Right.
because I had an amazing time, but I got sick right afterwards. Thanks to the cruise, I came home with this lovely parting gift.
Yeah,
Um,
of course.
got the flu, so I'm glad it
Yeah, but
wasn't
that's going
COVID.
around though. I don't know if it was because of the cruise, but it's been going around. They said it's the biggest surge in a while. So, you
Yeah.
never can tell what the way things are going these days.
Oh, well, I'm telling you what. So we were on the plane on the way out there. One of the bigger planes where you have like a middle section and then two on the side, right? So we're on this side, on the right side, and then our friends are on the other side of the plane. And so we can't really see each other, but I'm like listening, and all of a sudden I hear this person coughing and hacking 2 rows behind me, and I don't know if it sounded like an adult, it could have been a kid, I don't know, but it was like John and I looked at each other, we're like, "Oh, I hope that's not gonna, come back to bite us later," but it could have happened anywhere. It could have happened anywhere where we came across somebody who had germs or anywhere in the airports, who knows, but hey, I got through it, thankfully, and so here we are. So, Maya, what have you been up to lately?
I've been pretty involved with some cases that I've been doing. I got to get my witness prep stuff going because one of them is coming up very soon. And it's just really interesting how, nowadays in today's scope, there's so much accountability for what you do. And it starts in the office, right? It starts in the office. It starts with the culture in the office. If there's not a
Mhm.
culture of being compliant, if there's not a culture of things doing right, then it always ends up in a bad way, whether it be from a patient or from who you're getting paid from. So, word to the wise, I mean, if you don't have compliance as part of your culture and understanding the repercussions of how that can affect your end, and this is just ongoing, So, compliance is part of life, and if your office doesn't have compliance as part of your daily life, then you really have some things to think about when it comes to your future and the integrity of your practice in the future.
100%. I think some of the things that you encounter in your work as an expert witness and the cases you look at are just can speak volumes to what is the potential if we ignore these things that I mean, what else can I say? It's flat out ignoring things.
Yeah. And these aren't like, tens of thousands. Now we're talking about multi-million dollar cases. And it's
Yeah.
not just, and it could be something as simple as reviewing a contract. You thinking that you can understand the granularities of a contract can make the difference of somebody suing you or not for incorrect payment or not enough payment or not enough services.
Mhm.
I see it all day, every day, and my favorite term, twice on Sunday, because people don't think that they need to do it when in reality you should. Really, truly.
Absolutely. Well, I think getting into our episode today, we're really going to I hope we're going to find some ways to help our audience understand how you can really create a better culture even just by looking at your inefficiencies,
Yeah,
looking at the way you conduct daily tasks, because again, compliance, as we talked about in a previous episode, is it has to be there first. You have to set those things up first. But I think today when we talk about working smarter, not harder, which is
man.
today's episode, I think that it's one healthcare is one of the best places to really focus on that, is
Yeah,
because we have so many overworked physicians, so many people getting burned out in healthcare because ever since the pandemic, of course, we really truly saw what burnout can do because the overworked staff with all of the influx of people, I mean, like that really tested the limits of what people are capable of or not capable of. And so we really learned how many inefficiencies we had in our healthcare practices when we were tested like that.
right.
But I think it's a good reminder. Here we are in 2025. still not quite there. And we've been working to try to get ourselves back to routine and back to hopefully an efficient process if we can, because now we have telehealth in the mix. We have other types of healthcare deliveries that have kind of made their way on the scene more so than before the pandemic, of course. And so we've seen a lot of things. So we see miscommunication, we see billing denials, scheduling nightmares.
Yeah.
Yeah.
I mean, I also think, I mean, and this is really kind of how we're all going to kind of tie this all in, because we're going to do some case examples or some scenery examples. But I think it's also about having someone outside of your organization review operational workflows and optimize it
Mhm.
to a point where you're always working smarter rather than harder. And
Yep.
if you don't, and if everybody's used to doing the same routine, right, and there's no room for improvement, you're going to have holes through the cheese. And I think optimization from the EMR system, hello, uh, from from a professional standard, seeing what you're doing, seeing how it works, this all can make a difference. And we're going to show you how this makes a difference as it relates to our role play that we're going to do today. But you're going to be so surprised how one tweak of someone who has new eyes looking at your practice can make a difference in how your work is operationally functional, for optimally functional for the day to day, and making sure that it works for
Absolutely.
you. Yeah, yeah,
100%. Yeah, because I think that, like, when I did it, with the last practice I did that with, it was kind of exciting because they were so stuck in, like, okay, they know each other. They're with each other every day and they get used to those personalities and they think that the way that they interact is normal. And then
yeah,
if someone else comes in, they're like, why did you talk that way to that person? Like, are you okay? Like, to them, that was a normal interaction.
yeah, yeah.
Like,
Yeah, I mean, and even and when you say that, Jen, I mean, we also need to think about, just like medicine evolves, right? Technology evolves. So it
yeah,
doesn't have to be so manual. So optimize your workflow so that it adapts to today's technology. If you're still doing paper charts in this 2025, are you really optimizing the workflow, and are you stressing out the physicians, or is the physicians being more stressed out than what they should be? Even though the EMR regulation was back in 2009, but still, there's still a lot of things that you can make better by integrating modern technology into your daily workflows.
exactly. So let's talk about our next segment. The struggle is real, Maya. What about those hot mess mornings? Oh my goodness. I think we've had those hot mess mornings where you come to work and everything is a hot mess and your life is a hot mess, and you come to work and then everything at the office is a hot mess. So let's talk about this. So we're going to have a little role play, and
Okay.
I'm going to introduce you all to this practice. It's Monday morning at the Busy Bones orthopedic practice. And we're going to walk through a chaotic morning and let's see what's going on. So, we're going to talk to Maya first. She's at the front desk. And let's see what's going on with Maya.
Good morning. You updated your insurance? Oh, let me check. I didn't see it in the system.
Okay. Well, let's pause there. Let's check in with Jennifer. She's at the billing office. So, Maya, I see 3 claims got denied. Incorrect insurance info again.
Ugh, I've been swamped with calls, and I didn't have time to verify the insurance before check-in.
And there's another issue. Dr. Green forgot to document laterality again. This is going to cause another delay.
Oh, this is turning into a complete disaster. This is terrible.
And mind you, in the background, there's phones ringing off the hook. Everyone is upset, stressed out. There's papers everywhere, shuffling papers. You can imagine the sound, right, in an office. Oh, I'm already stressed out just thinking about this scenario. Like, it gives me hives just thinking about what is going on in that office today. So, whew.
Yep.
Okay,
And
let's
this
breathe.
goes back. Yeah, I mean, and this goes back to modernizing simple things. If you had an EMR system that automates your verification process, would there be time to hit a button rather than making a call?
Yeah. So the reality is, like, I mean, that was painful.
Yeah.
But it is the reality for so many organizations that
Yeah.
you have no idea. Like, and before I became a consultant, I was in my own little world in my little practice I worked in for 12 years. And I'm like, yeah, wow,
Yeah. Yeah.
that's how you do it?
Yeah. And I can't begin to tell you how the difference in having an integrated system or investing in the technology to make your office more efficient when it comes to updating insurance, laterality, NCCI edits to help identify if it matches, if it's billable, and then you create. Girl, I could. mm, I don't want to. I don't want to say it, but y'all hear me.
We feel you. So let's talk about the front office for a second, because Maya who is in billing and apparently also at the front desk. She apparently has a lot going on. So at the front desk, let's talk about what Maya was dealing with. She was stressed out because the patient comes in. To the patient, they expect that they have their information, because at some point they would have given it to them. But even if they didn't, whose responsibility is it, at least from a policy aspect? If your organization has a certain policy, usually they require who to make sure the insurance is collected.
The office themselves, and it should be done before they walk in the door.
But Maya, I don't have time to do that. I have so many other things I have to take care of. Who's
That's
going to
not
do
an
it?
Somebody's got to do it, because if it doesn't happen on the front end, it's going to get denied in the back end, and it's going to cost the practice twice as much money to make it correct. So it should be done.
Exactly.
Make time to do the right thing.
Right. So, I mean, there are ways you can, and it can make it seem like it's snowballing because you have all these calls and everything, but there are a lot of things that you can do before it gets to that point. And if it already is there for you, chances are you're trying to do too many things manually,
Yep.
because that's the reason why your phone's going off the hook. Now, some organizations that are really busy, they will sometimes do what I recommend is have an answering service. A lot of larger, like our hospital, we had that. So that way, the office themselves did not have to answer the calls. If a patient wanted to talk to a real person to make an appointment, they had a separate organization that made the appointments for them. They knew exactly how to schedule if they
Yep.
needed to talk to a person, but they still
Yep.
had their patient portal. So those that were tech savvy could jump on there, schedule their appointment. They were able to maneuver through that. And if there was an issue with the appointment they scheduled, then somebody would contact them and say, hey, I know you scheduled this online, but we're going to need to reschedule this to a different spot. Is this okay? Like, someone's communicating with the patient, even the patients that are using the portal, so that it gets done. So it
Yeah.
doesn't have to be the person that's right up front who has other tasks. You can be efficient and use external parties if you're an office that's that busy and you don't have time to prep yourself.
I
Things
mean,
are available to you.
right. I mean, and I do think that, being busy is always good, but optimizing the busyness so that it's effective and results in revenue is the key. You can't have a busy office and have an office full of patients, and then turn around and expect all those patients full of in the waiting room to convert to dollars. Think about those patients at the end of the day and how effective it is when it comes to converting those patients to claims. If you're not doing the right thing by optimizing your EMR system to make things more automated, you're going to stress your staff out, you're going to burn out, you're going to have call offs. It's just going to be a terrible, terrible waterfall effect.
Exactly. And then for the billing delays, yeah, there are things you can do and set up in the back end that can prevent some of these, where it's not necessarily a delay, it's more of a warning. So it might seem like it's delaying, but it's usually just a quick fix. So if your system is set up ahead of time to catch little errors, because we're imperfect, sometimes physicians do forget to add laterality. And so there are things you can do to have your EMR work for you and not you work for it. And
Yeah.
that's the problem. I can't stand when I see, let's just say social media, because it's a problem.
Oh,
These individuals going on there complaining about how their EMR didn't, or their billing system didn't do this right. And I'm like, It sounds to me like you're relying on your billing software to work for you
I think that's
and
the
like do your
misconception.
job.
I mean, and that's the misconception. We think that the system is supposed to do everything for us, but at the end of the day, it's about how you tell the system to do it for you. Optimizing the system for you, not the system optimizing the system for the office. It doesn't work that way.
They don't know what
It's
you need until you tell it. I don't know. I mean, like, it's not a human being, it's a computer brain. It's not, I mean, yeah, there's AI out there, but AI is not a person, guys, no matter what Hollywood tells you.
Yeah, I mean, AI is not a person, but it also can't work until you tell it what you need. Period.
Exactly.
I don't ever believe that there is that much automation that it goes inside your head because it has to plug into something to know what your head needs. I'm just saying. So we as a consulting entities implore offices to make the best out of what you have. But then if you're using it, you're a stakeholder. If there's a risk for you not having what you need, you're considered a stakeholder and you have a say in what happens in the office when there's inefficiencies with the system.
Exactly. Oh man, I almost lost my power there for a second, guys. Oh, I'm
Oh,
back.
yeah. You are back.
Oh goodness. Well, no, I agree. This is one of my biggest pet peeves. It has been for a while when I talk to physicians or organizations, and they just don't get that. Like, and you know who's the problem? No offense, is the reps that sell these softwares because they sell it to them. You can work less. Your EMR is going to do everything for you, and maybe they're told that that's a great pitch to give to a practice. It's going to sell them, but we're not. You cannot. I don't know. I have a problem
Well,
with some salespeople that push things on people without really explaining to them the impact of that software.
and that's why it's important for people who are stakeholders stakeholders to be involved with sales because they're going to know what questions to ask.
Mm-hmm.
And the problem is, can you do this? You're not answering my question. Can you do this? Can you do that? I can I've been on sales calls for EMRs, and it's really interesting how they kind of puddle around because they're not expecting someone like me to be on the call. So it's important from that perspective to have your stakeholders involved, know what is happening, have them who work the system be able to answer the questions, and make sure that they're able to implement or have the supporting team when it's that time for implementation. Oh, and implementation support. Two key words for optimizing EMR.
Absolutely. And please make sure you have somebody in your organization, or at least a consultant in the background that can be with you during the onboarding process, because I'm telling you, I've had nightmares I've had to fix for practices because the implementation expert was nothing like an implementation expert. Like they fell short of the
They weren't even in
implementation
person.
process.
In
Yeah.
most instances, they're not even in person. Sorry for talking over you. Gabe's gonna be
No,
mad at
you're
me.
good. You're
Sorry.
good.
uh, uh, Make sure that they're in person. They cannot see the workflow of what your office is doing if they're virtual. They need to see the physical workflow of the office to get a gist of how it should work. Period.
Exactly. So, I mean, it doesn't hurt to have somebody come in if you have issues and just take a look and see, okay, like, is there something we can do better to work smarter, not harder? Of course, is the name of the game. So now let's go visit the Smart Clinic because they've learned a few things and they're a little smarter than they used to be. So let's talk to the Smart Clinic. So this is the same clinic they've rebranded. Apparently, they're no longer the Busy Bones Orthopedic Practice. They're now the Smart Clinic, and we're going to see how they were able to have someone like myself or Maya come in and help them with their workflow and see how they now change their not only their process but their attitude. And let's see how just a simple workflow change can affect them. So we're going to check in again with Maya at the front desk and see what's going on with her today.
Good morning. I see your insurance has been updated. Thank you for submitting that through the portal.
Excellent. I like that one. And we're going to check with Jennifer over in billing. Now, Maya, I don't see any denials this week. That's great. Our pre-verification process is saving us so much time.
And I just double checked the schedule and no double bookings today. Everything is running smoothly and coming up roses.
Oh. And in the background, you hear some calm music, just some light typing, phones ringing at a manageable pace. I like that. Where they're not just like coming in because you know what? Did you catch it, guys? They have a patient portal. So proud of this clinic. Oh my goodness, I'm so proud of them. Yay. They got themselves a portal. And you know why that's efficient? Because if you don't have a portal, guess what? Patients, they have nothing else to do but call you every time they forget when their appointment is. So I guarantee you, offices that don't have a portal and they're getting the phone ring off the hook, that's the reason. Because either the patients wants to talk to somebody, or they're like me and they forget what they did yesterday or forget what they did 5 minutes ago and they can't remember their appointment. They didn't write it down. So yeah, it's nice to have a portal because then you can just log in on your phone and say, oh yes, it's tomorrow. I better remember this. So good stuff there.
Yeah, I mean, and even using a patient portal not only creates a smooth line for appointment reminders, but there's communication. There's you can upload it. It's portable. Your phone is always with you. Having a patient communications portal is going to save you so much time because it reminds patients of appointments. It updates. It can even send health risk assessments prior to the appointment. So it's just a for Epic, I believe it's my chart. For ECW, it's Hilo. So
Yeah.
you have all of these different types of systems that help enhance the patient experience. But think about if that wasn't there, how much more work the office is doing.
Oh yeah, I've seen it. One of the most recent practices that I helped did not have a patient portal until they were able to connect it. And, you know, I think that was a huge stress on the front office. And the people at the front office, they were stressed. It was coming across in the way they talk to patients, where they talk to each other, because it's like a family. You work with each other every day. If you're stressed out, they're going to feel it because you're going to react in a way you might not react if you weren't stressed out. So think about the health of your team, first of all. I mean, like giving them the tools they need to be successful is going to reduce their stress. It's going to help them be healthier people. They're going to enjoy coming to work because no one likes to come to work stressed. I mean, I want to enjoy my work and I do enjoy my work. There are days where I'm like, yes, I'm not feeling it. But for the most part, I really enjoy what I do. And I really try to maintain a clear head and focus on why I do what I do. And I'm grateful that I have learned what I've learned over the years, trial and error maybe, but just learning from others. And now I am in a good space and I feel like I know what it takes to be successful. And I know why it's important to have certain technologies in my life because without them, I can't be efficient. So you mentioned earlier claim scrubbers. Not all EMRs offer that. So is that a good question to ask your EMR vendor if they offer that?
Absolutely. Because if you don't have claim scrubbers, the end result is denials, right? Or medical necessity denials, and it could inadvertently affect your aging, right? Because denials creates aging if you don't work them. And if those claim scrubbers were there in place at the first time the claim is submitted, you would know that the claim needs to be worked before it goes out the door. So I always say an ounce of prevention is worth a pound of cure. The more systems you have in place to prevent errors, the better off your office will be.
Right. And let's say you're trying to cut costs, and not that I want you to cut your staff, but if let's just say that you feel like you don't need that many billers or that many coders. And that might be true because maybe if you set your system up to be efficient, those people that were working on coding straight every day or billing could be used in other areas of the clinic to be more efficient, because if your system is set up to catch those things, they don't have to spend hours working on claims that just to make sure things are right. And I've met some pretty savvy billers and coders, that really know their stuff, but they don't have the ability to memorize the entire NCC manual. They don't have the ability to memorize all of the data that is in the PTP edits. It's impossible. So
Well,
you have to have that.
and it's not even, let's just keep it real, Jennifer. A lot of people don't even know. I'm just saying, especially if you're in a billing world, that even the NCCI edit tool exists.
It's true.
So when you think about that and how you have a claim scrubber that does it for you, that eliminates that for the most part, and you can work the claims based upon what you have. But it's all about return on investment. You have to understand the return on investment when it comes to prevention and making sure that your claims are paid fluidly, not stagnantly. Because if they're fluid, then you have constant income. If they're not fluid, you have bottlenecks, and that could cause a problem.
Right. So run a report and do some math, guys. Okay. So I want you to calculate how many times a particular person is touching a claim. You can run reports on that and calculate the cost there. Then I want you to go in and I want you to, first thing you need to calculate how much does it cost monthly to use an efficient EMR that does all these things for you. Calculate that versus the cost of maybe a smaller one that doesn't have the bells and whistles that you need. Are you really saving when you're spending more on staff time to fix issues that your EMR or your PM system could have done for you? And then look at how many denials you have. Look at the cost of just the claim amount in themselves. You can do some quick math also to figure out, the Medicare rates, for instance, on your high dollar claims, how much money you could get if you got it paid within 30 days. And if you did that efficiently. But think about how much money some practices have over $1 million in AR sitting there. And that's a lot of money, guys. When's the last time you had $1 million?
Well, let's even take it a step further. When you do claims and there's a claim payment that's submitted and you have the electronic remittance advice, are you printing it down? Are you reviewing those $0 claims? Like having an electronic remittance advice uploaded only posts the payment. It doesn't transfer the balance. So when you think of a system, this billing company is doing it or the system is doing it, are they really? And why is it that you have $1 million AR that's up with no patient balances?
Yeah. Where is that money supposed to come from? The payer.
Yeah. And you're resubmitting claims that will never be paid because it's already been paid or it went to the deductible.
Right. And we used a software called Athena. I think you might have heard of it.
Yeah.
And we worked out of a queue. And so I was in the orthopedic practice most of my time at the hospital. That's where I live mostly. I worked in GI and general surgery, but mostly I worked in that clinic. So I was in there all the time. I had it cleaned up really good. And then I look at other buckets for other practices and I was like, how come they have this many denials? Nobody's working them. So they asked me to kind of help primary care and some of these other ones, which was kind of scary because I didn't know primary care. But I just pulled a zero pay report. I could not believe how many claims were completely fixable. And nobody knew this even existed. They didn't know, in the office anyway, that was working these. They didn't know that these zero pays, for instance, were completely payable. It was just a basic error that could have been fixed. And it wasn't even something, and it wasn't even something that I needed a lot of training to know because I'm a coder. I got my CPC, I know stuff. So I didn't have to have experience necessarily in primary care to know what was wrong.
Yeah.
And so it was an eye-opening experience for me that even as a biller, AR, even if you don't have experience in that specialty, there's a lot of things that are going wrong on the back end that you don't even need a specialized training in because it's common sense stuff.
Right.
That's happening.
And I think, the standard is being set higher now because before they just threw the front office to the wolves. But now you have CRCR certifications, you have CPB
Yeah.
certifications, you have RMS, Revenue Cycle Management Specialist certifications, where this is something that the standard and the credential is going to validate your work and knowledge in working the front desk, the CPAR credential.
Mhm.
These are things that should be in place for your office to work effectively and a streamlined, fluid revenue workflow, a fluid revenue stream. But again, if you don't think that there's a return on investment for paying a higher dollar, for that patient who's or that front desk person who's certified, then you're going to lose revenue. You're not going to last long as a practice because your claims are not going to be paid and you're going to spend more money trying to hire somebody to either defend you or clean it up. Now, which one do you want? I wouldn't want either. I would just want to have the person that's certified that knows the regulations, knows FCA, know the federal sentencing guidelines. These types of things make a difference. And if you don't
Mhm.
think it's worth it, then maybe you're not going to be in business that long. I'm just saying.
Agreed. And so tomorrow I want you to run reports. I want you to look at your key metrics. And again, it's not just about keeping track of claims and revenue. It's about even just efficiencies in scheduling. So look at how efficient your scheduling is. Are there gaps that you see there? Are there gaps in other areas of your practice that you need to look at? So some of these small things can really have a big impact. And one of the best ways for you to improve um, and be efficient is to attend the upcoming Bone and Joint Summit. And I know it's specific for orthopedics, but if you're not orthopedics, maybe you want to learn a specialty. We're going to have revenue cycle experts on day one. We're going to have our coders and documentation experts on day two. But this is the most amazing event that even though I plan it every year, I get so excited of all of the impact that we get every year, people telling us how much it benefited them. So this year is completely different. We have 2 days and each day has 2 tracks, guys. So I don't even know, like so many speakers that we're going to be bringing in that you're not even going to know what to do with yourself. You're going to have so much knowledge thrown at you. And so the first day is all about revenue cycle uh, administration. So we want our admins and our billers to really focus on day one. And then day two is going to be for our coders and maybe our physicians, documentation experts. We are going to have panels. I already have lined up approved speakers, physician speakers. I got payers. We're going to have people from different aspects, admins. We're going to have different panels. So it's not a presentation, it's an interview. We're going to talk to these individuals that do this every day so that you can see how it's done, what they've learned over the years, and how they communicate and how they are efficient. Because that's what we need. We need to learn from others that are doing it right and see, okay, how can we implement what they're doing in our practice to be more efficient? And that's what
And
it's about.
and success strategies, right? Because once you see that people are doing it right, that's a means of success that you can implement. It's a blueprint for success to make your
Exactly.
practice perfect. Hello.
Exactly. So we encourage you to stay tuned for more information as we bring that out. You can check our social media for Healthcare Inspired, one of our sponsors. You can also check our website, healthcareinspiredllc.com. We will have more information in our show notes on how you can purchase tickets. And we are also promoting a call for speakers right now. So until April 4th of 2025, you can, of course, apply to be a speaker. We're looking for anyone in revenue cycle, anyone, of course, especially orthopedics. But if you have knowledge of multi-specialty in revenue cycle, you're welcome to apply to speak because your knowledge is valuable. If
Hmm.
you have a topic on just communication or a topic on growth in your career, all those things are welcome. Anything having to do with healthcare management, and then, of course, coding and billing and all that good stuff. So stay tuned for more on that. And before we wrap up, I wanted to make sure everyone realizes the reason we have this podcast is to make you feel better about what you do, to give you the tools and resources you need to be successful, because we've been there. We know what it's like, and we want to help create stronger, more efficient practices where everyone knows the role they play and they know that when they do it correctly, everyone benefits.
And Jennifer, don't forget tomorrow we have your bone
Oh, yes.
presentation tomorrow through MeduTrain. That's tomorrow at
Yes.
11:30.
Yeah, so 1 o'clock Central.
Oh, okay, yeah.
And yeah, 1 o'clock Central. Yes, I thank you for reminding me. I don't, we have webinars, guys, every month. We have 2 webinars a month with our MeduTrain platform. So yeah, jump over to mdutrain.com and you can check out all of our upcoming content. Next month, in March, we have Critical Care with Maya, the first, of course, Tuesday of the month. And then I will be speaking later on. Excuse me, no, Kimberly Jolivet-Williams will be speaking later on next
Cardio.
month on cardiology, on our office-based cardiology. I think that's a really great topic too, because we
Absolutely.
often think about surgery, but I wanted to like really bring out a lot of people have amazing success when they talk to Kim about the office-based stuff, because those denials that we get, a lot of them are just for those tests that we do. A lot of
Uh-oh.
LCD policies, a lot of LCDs are attached to some of those diagnostic tests that they
Yeah.
do in cardiology. And so I think it's a good idea to look at that, marry some of the E&M guidelines with our NCCI, looking at LCD policies, all that stuff, because even though they're small amounts, they add up if you don't get them right. So
Yes.
so stay tuned for that on March 19th will be that presentation with Kim. And we look forward to a lot more education. We'll be keeping you updated on coming through the pike. So we have Practice Perfect as our podcast. Healthcare Inspired is our sponsor. We also have the MeduTrain which is our education platform. So a lot of integration with our collaborations here. And so please stay tuned for more. We hope that you have enjoyed this episode, where every episode is designed to help you perfect your practice and one smart move at a time. We will see you soon. Thank you for listening today.